Hello, my name is Juan Ramirez. I'm going to be making a video on tips for healthy pregnancy, and my class is BSN 346, Section 12. So you're going to have appointments to go see the doctor from when you become pregnant to your 28th week. You will see the doctor once a month, and that's about 7 appointments. Then from there, you'll go from 28 weeks to 36 weeks, and you'll see the doctor twice a month, which is 4 appointments. And then 36 weeks to birth, you'll see the doctor weekly, which is about four appointments, a total of 15 appointments. Um, in your first appointment, what you should expect is the doctor to ask you about your past medical history. He will ask you if you have previous pregnancies, abortions, when's your last period, about your past medical conditions, your family history, medication you're taking, allergies. So anything about your medical history. Also, he'll do a physical exam, which will include a pap smear, a pelvic exam. He'll do a UA, do blood to check if you're anemic, and he'll do a test for your RH status. So that'll be on your first visit. Then on after that, you'll continue to have visits from week 9 to week 28, and in that visit, they'll check your vitals, your blood pressure, your weight. They'll do still an UA to check for protein in the urine, and if you're swollen, which are part of preeclampsia. They'll check your fundal height. They'll do a sugar test or sugar level, see where you're at. They'll do an ultrasound, and that'll be in those weeks. And then after that, from week 28 to when you give birth, you will have the same tests, but they will add the non-stress, and then they will also add vaccines. So the doctor will give you checking your vaccines for the flu and the tetanus and the Tdap. Some labs and diagnostics that will be used during your pregnancy will be by your trimesters. So in your first trimester, you'll get a urine test to check for infections and other stuff. Then you also get the RH factor, the protein, to see if you're compatible with the baby. They'll check your blood work, which includes your blood level and for anemia. They'll do a pap smear to check for cervical cancer. They'll do the ultrasound, and also they'll do tests to check for abnormal chromosomes. If the fetus has any chances of having abnormal chromosomes. In your second semester, in your second trimester, they'll do a quad screening, which also checks for abnormal chromosomes. They'll do the glucose test to see if you're diabetic gestational. They'll do the amniotic fluid, where the baby's in the uterus. They'll check the fluid to see if it shows any genetics in the baby problems. That'll be for the second trimester. In the third trimester, they'll do a non-stress test to monitor the heart rate and also to see for movement and to check the oxygen of the baby. They'll also do a Group B strep test to see. Sometimes from the mother, the vagina, she could have bacteria, and it could come to the baby and cause harm. So those are those tests. For nutrition, there'll be supplements and vitamins and different types of food to consume. For the food will be to eat fruits and vegetables. You want to eat cereal and bread. All those will have fiber that will help you with your digestive. You want to eat meat and chicken that will help you with to get protein. You want to eat milk and yogurt where you will get calcium. You want to stay hydrated, drink a lot of fluids. From the foods, you'll get vitamins, but you also want to add more vitamins and supplements that you would need. You want to take folic acid, which helps prevent spina bifida. You want to take iodine, that helps the development of the brain and the nervous system. You want to take vitamin B12, which also helps with the nervous system and the development of the brain. For during your pregnancy, you will gain weight. It depends at where you at. So if you are underweight during your pregnancy, you will gain around 28 to 40 pounds during your whole pregnant, and then your BMI should be less than 18.5. Then during the week, you should gain about 1 to 1.3 pounds. If your weight is normal, you should gain between 25 and 35 pounds during your pregnancy, and then your BMI should be 18.5 to 24.9. And then throughout the week, you should gain 0.8 to 1 pound. If you are overweight, you should gain 15 to 25 pounds, and your BMI should be 25 to 29.9. During the week, you should expect to gain 0.5 to 0.7 pounds. And then if you are obese, you should expect to gain 11 to 20 pounds. And then during your pregnancy, and your BMI should be greater than 30. And then you should expect to gain 0.4 to 0.6 during the week. And if you notice, the weight is based on how big you are. So the smaller you are, the more weight you will gain. The bigger you are, the less weight you will gain. I want to talk about exercise. So you should exercise every day. You should do 30 to 60 minutes from low to moderate exercise. Good type of exercise would be aerobics and straightening. With aerobics, you want to do walking, you want to do cycling or swimming. With strengthening, you want to take a yoga class or Pilates. You want to take do stretches that will help your abdomen. Some exercises that you want to stay away from would be contact sports, which are exercises such as kickboxing, football, tennis, anything that you're at risk of being hit. You want to avoid those sports. Also, you don't want to lay on your back after your 28th week because it'll be hard on your body. And you want to avoid exercises that will make your temperature rise or make you hot. During your pregnancy, you will have complaints um, that will happen, and I'm gonna tell you three top complaints that women complain of. which will be constipation. A way to prevent constipation would be to drink a lot of water, take fiber, eat fruits and vegetables that could provide you with fiber. You also want to take over the counter medications like Metamucil or Colace. Another one would be heartburn. And to prevent heartburn, you would eat small meals, take small sip of waters. You want to avoid spicy food or greasy food, drink milk, and take Tums. And the last one would be short of breath. So when you're pregnant, usually your uterus will hit your lungs, so it will make it hard to breathe, and also your uterus will also sit on your stomach, and it will um, press on the stomach valves, which is your uh, vena cava and your aorta. So it will block the perfusion, or it will limit the perfusion, and then it will be hard for perfusion to reach. So if you lay on your left side, it will help perfusion to reach. That way you won't be short of breath. Um, so those are the three complaints that you could experience. Um, there will be times that you will have to call the MD. Some of those reasons would be if you're bleeding, and that could be because you might have a miscarriage, and also if you have placenta problems, if you have trauma from sex, you could bleed. If you have abdominal trauma, infection, and if you have a premature labor, that could cause bleeding. If you have abdominal pain, you also want to call the MD because it could be maybe you're having Braxton Hicks contractions, or maybe you had a miscarriage. Um, Also, constipation could cause pain, so that would be reason to call the doctor. And then another one, if you have a headache or blurry vision, you want to call the doctor because that could be a sign of preeclampsia. And then if you have high blood pressure, or if you have swelling or urine protein in the urine, that's another sign that you have preeclampsia. So those would be reasons to call the doctor. And those are the tips for to have a healthy pregnancy. Thank you so much.